After the end of the global COVID-19 pandemic, reports began to appear about changes in the course of cancer in some patients who had suffered severe forms of COVID-19. Oncologists know at least 7 viruses that cause tumors. These include human papillomavirus, hepatitis viruses, human herpes viruses, Epstein-Barr virus, herpes virus associated with Kaposi's sarcoma, Merkel cell polyomavirus, and human T-cell leukemia virus. Are coronavirus and vaccination a factor in the transformation of a normal cell into a cancerous one? This question is increasingly beginning to worry both patients and oncologists. The long-term consequences of the epidemic in the world are still being studied. Conclusions about the role of coronavirus and vaccination in the development of cancer will be made in many years, perhaps decades. But today, patients should already know ways to prevent cancer in the era of a global pandemic and hasty organizational and commercial decisions. Today, we can say with confidence that the virus has changed the course of cancer in many patients. In this broadcast, I will tell you about research into the role of coronavirus and vaccination in the cancerous degeneration of organs in people who have had COVID-19. Then, we will touch on a hot topic. Can coronavirus vaccination cause cancer? In conclusion, I will talk about methods of cancer prevention in patients who have had COVID-19 and been vaccinated. The description of the video provides links to the information used in its preparation. Recent studies indicate that patients who have had a severe form of COVID-19 may have an increased risk of developing certain types of cancer, such as HER2-positive breast cancer, esophageal cancer, colorectal cancer, stomach cancer, and colon cancer, lung cancer. It should be emphasized here that research in this area has just begun, and we only have preliminary data. It is impossible to say today that SARS-CoV-2 and vaccination caused cancer. However, the risks of malignant transformation of tissues exist. What mechanisms of SARS-CoV-2 action on cell transformation into malignancy are already known. It is assumed that SARS-CoV-2 can use various mechanisms to affect cells, leading to carcinogenesis. For example, the virus can cause genetic and epigenetic changes that affect the expression of genes associated with cancer development. It has been established that COVID-19 infection can weaken the immune system, reducing its ability to recognize and destroy cancer cells. In addition, the inflammation caused by the coronavirus in a chronic form can lead to cell damage and create conditions for tumor growth. Inflammation enhances the proliferation and migration of epithelial lung cancer cells. High levels of cytokines can damage cells and tissues, increasing the risk of mutations and the development of malignant neoplasms. Anti-inflammatory factors, interferons type 1 and IL-10, are usually depleted during cases of this infection. COVID-19 can cause long-term damage to the lungs, liver, and other organs, increasing the likelihood of pathological changes, including precancerous ones. An important factor in the development of cancer in COVID-19 patients may be a lack of oxygen, hypoxia, caused by lung damage, which can activate hypoxic signaling pathways that are associated with tumor development. COVID-19 can reactivate dormant viruses, such as the Epstein-Barr virus. Coronavirus infection can increase the level of free radicals, which leads to DNA damage and can stimulate oncogenesis. Inflammatory reactions can affect hormonal levels, which in some cases increases the risk of developing hormone-dependent tumors. COVID-19 can cause metabolic disorders such as diabetes mellitus, which is a risk factor for cancer. Stress during the pandemic can lead to increased cortisol levels, which weakens the immune system and can promote cancer. After COVID-19, some patients develop pulmonary fibrosis, which increases the risk of lung cancer. Viral infection usually causes increased DNA repair activity, which increases the risk of mutations. Induction of carcinogenesis is associated with many molecular events associated with SARS-CoV-2 infection, such as cytokine storm and increased incidence of coagulopathy. Coagulation events such as disseminated intravascular coagulation are common in cancer patients. This is mainly due to the release of cancer-associated factors that significantly increase the threat of thrombosis and increase the risk of cancer metastasis. An important mechanism of cell malignancy in coronavirus is the activation of immune evasion of malignant cells. T-cell suppression is important for the development of cancer in survivors. In addition, SARS-CoV-2 can drive carcinogenesis by causing oxidative stress, genomic instability, and degradation. Thus, today, the ways in which coronavirus influences carcinogenesis in human tissues are already known. This requires the development of methods for preventing cancer in survivors of coronavirus. I will talk about preventive measures at the end of today's broadcast. Another important consequence of the epidemic has been the emerging reports of a possible carcinogenic effect of vaccines used to prevent coronavirus infection. There have been reports in the press about an increased risk of developing cancer after vaccination. The term turbo-cancer has appeared. Turbo-cancer is a term that has emerged in anti-vaccination circles and is used to describe a supposedly new type of cancer that develops rapidly in people vaccinated against COVID-19. Especially with mRNA vaccines. Proponents of this theory claim that vaccination can contribute to the development of aggressive forms of cancer. Opponents of vaccination claim that mRNA vaccines can cause or worsen cancer. For example, they refer to the theory that traces of DNA contained in vaccines can integrate into the human genome and activate oncogenes, which leads to the development of cancer. However, these statements do not yet have scientific basis and are refuted by many studies, although in my opinion it is too early to draw conclusions. Because carcinogenesis is a complex long-term process that depends on a large number of external and internal factors. Conclusions can only be discussed many years or even decades after the end of the global pandemic. However, scientific organizations say that there is no evidence that COVID-19 vaccines cause cancer or contribute to its progression. Moreover, studies show that vaccines do not change human DNA and do not lead to an increase in cases. There are many unanswered questions here. The fact is that changing the human genome is a dynamic process. It depends on many factors. The leading factor is time. Some anti-vaccinationists refer to data from the Vaccine Adverse Event Reporting System. They claim that the number of cancer cases has increased sharply after vaccination. However, this data is often interpreted incorrectly and does not take into account many factors, such as previous diseases or other reasons for the increase in morbidity. In the debate between supporters and opponents of vaccination, it should be noted that the research conducted in this area is still far from complete, and the effects of vaccination will be studied many years after the end of the epidemic. In this regard, the haste of statements by leading oncology centers is alarming. In addition, the interest of companies producing vaccines used to prevent coronavirus infection is important. Patients recovering from COVID-19 infection or vaccination require increased attention to their health. Preventive measures may include the following recommendations. 1. Maintain a healthy lifestyle. It is necessary to stop or significantly limit smoking and alcohol. Smoking is one of the most significant risk factors for cancer, especially lung cancer. Limiting alcohol is also important, as it increases the risk of liver, mouth, pharynx, and esophagus cancer. A balanced diet is important. A diet rich in vegetables, fruits, whole grains, and fiber can help reduce the risk of some cancers. Try to avoid foods high in sugar, trans fats, and processed meats, sausages, hot dogs. Regular physical activity. Physical activity has been shown to help reduce the risk of breast, colon, and other cancers. It is recommended to do at least 150 minutes of moderate exercise per week. You can learn more about the effect of carbon dioxide produced by the body's cells on metabolism in the human body in my corresponding broadcasts, which are dedicated to methods for strengthening the body's anti-tumor defenses. Links to the broadcasts will be in the description under this video. 2. Weight control. Excess weight or obesity is associated with an increased risk of developing cancer, including kidney and pancreatic cancer. Gradual weight loss under the supervision of a doctor can be helpful. 3. Regular medical examinations. It is important to undergo regular examinations and screening procedures, for example, mammograms, colonoscopy, HPV tests, and cervical cancer tests. Patients who have had COVID-19 or been vaccinated may find it useful to discuss an individual monitoring plan with their doctor, especially if they have a hereditary predisposition to cancer or chronic diseases. Heredity is especially important, since it is associated with the resistance of the human genome to the effects of the virus. 4. Monitoring the body's condition after COVID-19. Studies show that COVID-19 can affect the immune system. People with weakened immune systems may have a higher risk of cancer, so special attention should be paid to infection prevention, a balanced diet, and a healthy lifestyle. 5. Avoiding excessive ultraviolet radiation. This will help reduce the risk of skin cancer. Use sunscreen, wear protective clothing, and avoid sun exposure during peak hours. 6. Stress control and management. Chronic stress and its consequences, such as depression and anxiety, can negatively affect the immune system and overall health. Relaxation practices, meditation, yoga, as well as mental health support are important for the overall health of the body. How Eastern health technologies and human consciousness affect metabolism, I will also provide in the corresponding link under this video. 7. Monitoring long-term symptoms and consulting a doctor. If after COVID-19 or vaccination, you notice unusual symptoms such as fatigue, pain, sudden weight loss, changes in bowel function, or a cough that does not go away, consult a doctor. This can be useful both for monitoring the condition after COVID-19 and for ruling out other possible diseases, including cancer. These recommendations will help not only reduce the risk of cancer, but also improve overall health, which is important for the body's recovery after an infection or vaccination. Since coronavirus leads to increased blood clotting, it is important to note that low doses of aspirin are used to prevent some forms of cancer while monitoring the condition of the gastrointestinal tract. It is also known that the use of aspirin reduces the manifestations of coagulopathies in coronavirus infection and during vaccination. Therefore, low doses of aspirin can be used to prevent cancer in patients with coronavirus and vaccinated. But when using aspirin to prevent coagulopathies, constant medical supervision is necessary. This must be remembered, given the side effects of aspirin. Thank you for your attention. The next broadcast will be devoted to the effect of SARS-CoV-2 on the course of cancer in cancer patients and the prognosis. In it, I will talk about the possibilities of preventing relapses and metastases in patients who have undergone cancer treatment and have had COVID-19.